1. Which of the following is the primary purpose of the FPGEE exam? A. To evaluate pharmacy graduates' ability to practice independently without supervision. B. To assess the equivalency of foreign pharmacy education compared to U.S. standards. C. To provide licensure directly for foreign-trained pharmacists. D. To test knowledge in clinical residency programs only. 2. The FPGEE exam is administered by which organization? A. National Association of Boards of Pharmacy, NABP. B. Food and Drug Administration, FDA. C. American Pharmacists Association, APHA. D. Accreditation Council for Pharmacy Education, ACPE. 3. Before taking the FPGEE, foreign-trained pharmacists must first complete which process? A. Apply directly for state licensure. B. Submit credentials for verification through the Educational Credential Evaluators, ECE. C. Take the NAPLEX first. D. Complete a residency program in the United States. 4. Which of the following is not a major content area of the FPGEE exam? A. Basic biomedical sciences. B. Pharmaceutical sciences. C. Clinical sciences. D. Veterinary medicine sciences. 5. Approximately how many multiple-choice questions are on the FPGEE exam? A. 150. B. 200. C. 250. D. 400. 6. What is the time limit for completing the FPGEE? A. 2 hours. B. 3 hours. C. 4.5 hours. D. 6 hours. 7. The passing scaled score for the FPGEE is A. 60. B. 65. C. 70. D. 75. 8. Which of the following subjects has the largest weight on the FPGEE exam? A. Basic biomedical sciences. B. Clinical sciences. C. Social, behavioral, and administrative sciences. D. Pharmaceutical sciences. 9. After passing the FPGEE, what is the next step for foreign-trained pharmacists? A. Apply for state licensure immediately. B. Register for the TOEFL IBT exam. C. Take the FPGEE directly. D. Apply for U.S. residency programs. 10. Which testing method is used for the FPGEE? A. Computer-based testing. B. Paper and pencil exam. C. Oral examination. D. Practical skills demonstration. 11. The FPGEE primarily evaluates knowledge and skills at what level? A. Doctor of Pharmacy, PharmD entry level. B. Associate degree level. C. Pharmacy technician level. D. Graduate residency level. 12. Which of the following is an eligibility requirement to sit for the FPGEE? A. U.S. citizenship. B. Completion of at least a 4-year pharmacy degree program outside the U.S. C. Passing the NAPLEX first. D. At least 1 year of U.S. internship experience. 13. How often is the FPGEE offered each year? A. Once. B. Twice. C. 3 times. D. 4 times. 14. Which of the following organizations provides credential evaluation for FPGEE applicants? A. World Education Services, WES. B. Educational Credential Evaluators, ECE. C. American Council on Education, ACE. D. Kaplan Test Prep. 15. A candidate's FPGEE score is reported as A. Percentage of correct answers. B. Scaled score between 0 and 150. C. Pass-fail only. D. Letter grade A to F. 16. Which of the following best describes the format of FPGEE questions? A. True, false statements. B. Multiple choice, single best answer. C. Multiple select questions. D. Short answer written responses. 17. Which U.S. exam must candidates pass after FPGEE to demonstrate English proficiency? A. IELTS. B. TOEFL IBT. C. Duolingo English Test. D. TOEIC. 18. A pharmacist trained in a 3-year program abroad would most likely A. Be eligible directly for the FPGEE. B. Need to prove additional coursework or credentials. C. Skip FPGE and take NAPLEX. D. Apply directly to the MPJE. 19. Which of the following best explains the importance of FPGEE in U.S. pharmacy licensure? 8. It certifies a pharmacist's clinical residency training. B. It determines equivalency of foreign pharmacy education to U.S. standards. C. It replaces the need for NAPLEX. D. It provides temporary practice permits. 20. If a candidate fails the FPGEE, how long must they typically wait before retaking it? A. 30 days. B. 60 days. C. 6 months. D. 12 months. 21. Which of the following best describes the scoring system of the FPGEE? A. Number of correct answers only. B. Scaled score adjusted for difficulty. C. Curve-based relative to other test takers. D. Weighted only by biomedical sciences. 22. What is the approximate percentage weight of the clinical sciences section on the FPGEE? A. 10%. B. 15%. C. 25%. B. 35%. 23. Which group of pharmacy graduates is not required to take the FPGEE? A. Graduates of ACPE-accredited schools outside the U.S. B. Graduates of 5-year pharmacy programs in Europe. C. Graduates of non-ACPE-accredited Asian schools. D. Graduates of South American pharmacy programs. 24. The FPGEE is considered which type of exam? A. Licensure exam. B. Equivalency exam. C. Residency entrance exam. D. Employment qualification exam. 25. Which of the following is true regarding the FPGEE application process? A. Candidates can apply at any time of year. B. Applications are accepted only during NABP's designated registration windows. C. Candidates must first pass the NAPLEX. D. Applications are handled by state boards of pharmacy. 26. Which is the official guide provided by NABP to help candidates prepare for the FPGEE? A. Kaplan Pharmacy Review. B. Official FPGE competency statements. C. ACPE accreditation standards. D. NABP internship handbook. 27. Which of the following statements about the FPGEE exam is correct? A. It is administered internationally and domestically in selected test centers. B. It is only offered in paper format. C. It can be taken without credential evaluation. D. It provides direct U.S. licensure after passing. 28. Which competency area includes knowledge of pharmacokinetics and pharmacodynamics? A. Basic biomedical sciences. E. Social, Behavioral, and Administrative Sciences. C. Pharmaceutical Sciences. D. Clinical Sciences. 29. Which of the following best defines the role of NABP in the FPGEE process? A. It evaluates pharmacy school curriculums abroad. E. It designs and administers the examination. C. It accredits foreign pharmacy programs. D. It conducts English proficiency tests. 30. Which subject area is least likely to appear on the FPGEE exam? A. Biochemistry. B. Pathophysiology. C. U.S. Healthcare Delivery Systems. D. Advanced Veterinary Surgery. 31. Candidates who pass the FPGEE are awarded what official recognition? A. Foreign Pharmacy Graduate Equivalency Certification, FPGEC. B. U.S. Pharmacist Licensure Certificate. C. State Pharmacy Practice License. D. ACPE Accreditation Certificate. 32. Which part of the FPGEE blueprint includes biostatistics and research design? A. Clinical Sciences. B. Basic Biomedical Sciences. C. Social, Behavioral, and Administrative Sciences. D. Pharmaceutical Sciences. 33. Which of the following is the primary language of the FPGEE exam? A. Spanish. B. English. C. French. D. German. 34. Which of the following steps must occur before registering for the FPGEE? A. Passing the TOEFL IBT exam. B. Credential evaluation through ECE. C. Completing a U.S. residency program. D. Taking the FPGEE exam. 35. Which of the following best describes the length of a foreign pharmacy program required for FPGEE eligibility? 8. Minimum 2 years. E. Minimum 3 years. C. Minimum 4 years. D. Minimum 5 years.